Hi, my name is Kasara Daget, and I'm a licensed clinical psychologist in Massachusetts, and I'm the owner of a private practice, Cup of Tea Counseling LLC. And with me is my esteemed colleague. I don't know where she's going to be, but I'm assuming it'll be over there somewhere.
I'm I don't know where you are either. We'll find out soon. Hi everyone. My name is Luana Bessa, and I am a licensed counseling psychologist in the state of Massachusetts. I have a private practice called Bella Lou's Health, and I offer consultation as well as clinical services in my practice. And I'm really excited for us to be together here today to talk to y'all about safety and safety in space and social distancing in the era of COVID-19.
And
So
I
did
should take a note from you to speak a little bit slower. I realized I started kind of fast, so I'll slow this down. So we've been seeing a lot of articles going around lately about safe sex during COVID-19. And one of the biggest challenges we've noticed is that if you're going to have sex in general, COVID-19 or not, you're at risk. And the same is true with precautions that we are getting around physical space and generally with other people. And we wanted to try and create this video to sort of break things down a little bit because everybody has a different interpretation of what social distancing means. But the challenge with the different interpretations is that it might put various people at risk if we're not all on the same page. So that's where we wanted to start.
Yeah, absolutely. Social distancing is a new term and it's getting thrown around like we're all on the same page about what it is. And people understand it so differently, right? Some people think social distancing means you just stay in your house and don't go anywhere and don't see anybody. Some people think that social distancing means I can go out wherever I want as long as I'm just with people I already know, right? So we're all kind of making up our own definitions about this. And we wanted to just present some ideas around what might be some good common sense precautions to take. And we thought that it might be a little more interesting to talk about that also in the context of sex and sexuality, that in the same way that there's no such thing as 100% safe sex, there's no such thing in the era of COVID as 100% safe contact, physical contact with other people. Now, social distancing does not mean emotional distancing. It doesn't mean that we stop nurturing our relationships. But when we think about how we do that and how we think about being in contact with other people in ways that are kind, in ways that are ethical, we just thought that we had some tips for you all today.
Yeah, so I guess because we're friends and also colleagues, I'll just refer to you as Luana when we talk about this. But
You
you,
may.
okay, thank you, thank you. I appreciate your permission. Consent is important. Um, but one of the things I've been thinking about, Luana, is that if we're both isolating, right, the risk is lower. You and I have been both isolating. But every time we step outside for some reason or another, particularly to go to the grocery store, which I'm the one who is doing that in my household, then the risk gets elevated. The clock restarts, to use the term that you've used with me. And so, because there's still a lot that we need to learn about this virus and in general, and also how that plays out with sex, it's useful to think about the precautions that we take in general with regards to sex also apply to the same precautions that we take regarding COVID-19. Do you have any thoughts about that?
Yeah, I mean, I think exactly what you said. For me, that expression of the clock restarting has been really helpful. So I think about the clock restarting as, what we know ish, right? We're still learning about this virus, but one thing that we have a good sense of is that the incubation period for the virus is about 2 weeks. So it could be anywhere from a couple of days to a couple of weeks, where if you've been exposed and you're now positive for the virus, that it starts to manifest the symptoms in your body. And so that's what we're thinking of when we use the term the clock, right? And so for me, if I went out grocery shopping, or if I met with the UPS guy to pick up the package, or if I visited a friend or a parent, whoever it might be, then for everyone involved in that interaction, because we've now come into contact with other people or potentially come into contact with the virus, then our individual clocks are restarting. So from that point on, I have about 2 weeks where if I was exposed, I may begin to develop symptoms. Now, what I want to say here is reiterating that we're still learning about this virus, reiterating that both Dr. Diane and I, or Kasara and I, we are mental health professionals. And so we're talking about how to think about exposure, but we're not providing physical medical advice. And so we're just drawing from, our exposure to the news and links that we've seen. And so based on my current understanding, it's about a 2-week incubation period. And so I need to be really mindful within that 2 weeks of what am I doing to keep myself and my loved ones safe. So if I went and saw a friend 1 week ago, and now I have someone in my life who wants to spend time together, right? How do I decide whether that's a good idea, right? Right now, I would say that it's not a good idea for anybody to do that, given our current guidelines. But I just want to be mindful about issues like consent, issues like just being really caring to that person, right? So I could say, oh, I'm fine. I'm sure I haven't been exposed. All I've done is go to the grocery store. But there's no such thing as just going to the store. There's no such thing as just seeing people we know, because the virus doesn't discriminate. And what we also know is that you don't have to be manifesting any symptoms to be a vector.
Right.
So those are my thoughts. I just wanted to break down a little bit what we meant by the clock, so to
Yes.
speak.
Mhm.
And every time we're stepping out, we are elevating our risk, as you
Yeah.
mentioned.
Yeah, and this is where the whole term safer sex comes in. So we're used to hearing it being called safe sex. Safer sex is really based on the idea that you can do as much to protect yourself and other people, but you can't actually 100% remove the risk. Sorry, I'm like slipping, unless you're just not having any sex at all, right? So we know for a fact that if we are engaging in sexual activity, even with what appropriate protections, that there is always still a risk. And so when we're talking about this whole resetting the clock, even though we might be engaging in appropriate protections like wearing our masks to the supermarket and our gloves, making sure that we're engaging in proper glove removal practices, washing our hands, not texting on our phone while we're shopping, things like that, that the fact that you're just in the grocery store means that you have an elevated risk. It might not necessarily be as high as if you're also rubbing up on tons of people in the grocery store, right?
Please don't do that.
But of course, because we, still there's a lot we don't know about the airborne properties of this virus, there are still other elevated risks. And so, in safer sex guidelines, the tagline is "You are your safest partner," right? That if you're just engaging in masturbation, no one else is involved, that is the lowest possible no risk situation you could be in. But as soon as you introduce another person into the situation or another environment, that's when we start elevating the risk. So, um, one of the things, Luana, you've talked with me about is just sort of the inherent risk in living your life. And I was wondering
Yes.
if you could just say a little bit more to people about what your philosophy is around that.
Yeah, 100%. What I'm thinking about as you talk about safer sex versus this illusion of completely safe sex, right, is that anytime that we engage with other people in a sexual context, there is some risk involved. And that doesn't mean that we completely stop living our lives. It means that we each make decisions about what level of risk we're willing to take. And when it comes to this new era that we're all living through right now, which is the era of this COVID-19 crisis, some of us have more ability to decide how much risk we're taking than others, right? Some of us already live alone. Some of us live with partners and children or other loved ones. Some of us have roommates. we have people in our environment, or we ourselves, who potentially don't have the luxury to stay home and who are needing to go out and work, go out and do shopping. And so just recognizing that there's an inherent risk anytime somebody leaves the home, and that, like with sex, if I am being monogamous with my sexual partner, but my sexual partner is, having sexual relationships with other individuals, I am essentially exposed to whatever they're exposed to. And so with COVID-19, it's the same thing. If I'm staying at home and self-isolating in that way, but I have a partner who's going to work every day, it's not just their clock that's restarting. I'm also at risk. But looping back around to where you were asking about, Kasara, this idea of living as being inherently risky, anytime that any of us ever step outside of our homes, we can't predict the future. We don't know what's going to happen in any given day. And life is an inherently risky proposition. Just by virtue of being alive, we're at risk. And so part of why I was bringing that up in the earlier conversation that Dr. Diet and I were having in preparation for this video is that it can be a thin line, thinking about being careful, taking precautions on the one side, and on the other side being kind of paralyzed by anxiety. And so our goal in this video is to offer some helpful suggestions and advice, but not to fuel anxiety. And if we just are aware that every day that we're alive, we are taking some risk. We're taking some risk by getting on the bus or getting in a car or going to work, just going about our lives, getting on a plane. But we do want to continue to live our lives, and every day we're managing that risk. Do I want to take the long way home that maybe doesn't lead me through a dark alley? Do I want to walk through that park? Do I want to not get in this car with someone who maybe has been drinking? And we manage those risks as best as we can, while being aware that as humans, there's so much that we cannot control. That's kind of what we're looking at on a magnified level with this virus. I think what it's doing is it's bringing to the forefront this existential, question, and these limits that we always have to our control.
Yeah.
Um,
And
but if
there,
we accept, oh, I'm so sorry, just if we
yeah.
accept the risks, then we can make appropriate choices about how to be safer. Yeah, go ahead.
Yeah, and you just reminded me that, there is a fine line between being vigilant and being paranoid, right?
Right.
You know.
Hi, everyone. Lucky really wanted to be part of this video, apparently. So, hello.
Hello, hello.
She is a wonderful social distancing buddy. She does not increase my risk because she does not go outside. So
Hi,
I
Lucky.
appreciate Lucky. All right. I'm so
Yeah,
sorry for our rude
no.
interruption.
I think everyone will appreciate it. We may be two professionals, but we're still two humans doing this video. And so, just going back to vigilance versus paranoia,
Mhm.
certainly, as you were saying, we don't want you to feel like you cannot live. But right now, it is true that our situation has necessarily put significant restrictions on living. And it can be very helpful to think about, though, that these restrictions are not only in the service of saving your life, but saving the lives of others, and also saving the lives of the healthcare workers, who the less people that they have to come into contact with, because hopefully we're all trying to make the best decisions possible, the better it will be for us in the long term. But obviously, the short term paralysis and discomfort of really not being able to live our lives in the way that we would like, um, is pretty significant. And so, certainly, when we're sharing this advice, we obviously both have that in mind, but I think it's worth pointing out, um, the tension between civic responsibility and the greater good, and one's own desire to live in the way that you would like. So, we
Right.
wanted, we have that little background, and we wanted to kind of move into just some tips that we have, considering all of these things in mind.
Yeah, I just wanted to add one last piece as
Mm,
we segue into that, Kasara, that when we're aware of the risk of of living generally, or of living in this time period where everything is magnified, we can be tempted to go in one of two directions,
Mm.
right? If life is inherently risky, then that means either that I need to restrict myself so much that I don't have a life, or if life is inherently risky, I'll just be completely reckless, right? And so part of what we're advocating for in this video is that balanced approach, and that's really where I think our tips are coming from.
Yeah, and our balanced approach, we are aware, leans in one direction more than another because of the consideration of the larger situation that we're in
Mhm.
and the risk at large. Um, so we're probably, tipping more towards be as careful as you can and don't make unnecessary contacts,
Mhm.
rather than being super in the middle. And so I think I'm aware that you and I have that. I guess we could call it a bias, but also, trying to follow the guidelines as best as we can.
So I completely agree. I think the way that I'm conceptualizing the middle when I talk about balance is absolutely be as careful as possible with contact, which is what
Mhm.
you and I are focusing on in this video, but find a way to do it where you're still nourishing aspects of your life that are important to you, right? So what does it mean for me to not put myself and others at risk, but also still feel like I have a life?
Mhm.
And so that's not necessarily the focus of this video, but there's a lot out there around, things that are happening online for free, and concerts and workouts, and, ways to connect virtually. So I guess I just wanted to take a moment and insert that here, that 100% my bias is toward staying home and away from risk as much as possible. I think that's what this time is calling for us to do. Uh, but as we just think about people's overall mental health, I
Mhm.
would urge them to think of that not just as a way to put a pause on their lives,
Right.
but a way to find new ways to nurture, right,
Yeah.
themselves.
And, certainly if people want to let us know if that's a video that they would want to see,
Yeah,
we could get
absolutely.
into that because for us, I think for this video, social distancing is a misnomer, as you've probably heard. That really, for us as therapists, we're thinking about it as physical distancing.
Yes.
Because when we hear social, we're thinking about that emotional um, contact that you can have with people, even if you're far away, and how to have that and also just nourish other parts of yourself. And so for us, we're really talking about physical distancing. And
Absolutely.
so if we're thinking about tips, we've mentioned a couple of times how going to the grocery store or needing to go to some kind of store automatically resets our clock. And so something that not everyone has thought about, some people are, some people aren't. And again, it just depends on where you're at and what your bandwidth has been and what information you've taken in, is letting, if you are planning to see someone, um, do you let them know where you've been this week? So for me, for example, I live with someone who has to go to work every day. And so that means that I technically have a clock that restarts every time that person comes home. And so that means that I'm really not seeing anybody. And if I am going to the grocery store, I'm definitely full gear, mask, gloves, everything. Um, and I'm not even arranging to see people at here you are 6 feet away from me. But for someone else, that might look a little different. But are you making sure to update people on what your movements and contacts are during the week? If you are talking about, well, let's go take a walk in the park, and giving them a chance to use that information to decide, well, maybe it's not a good idea that we hang out this week. Like, let's try when you've had a little longer of a time home. And so the informed consent, which is similar to sex, is something, and also to therapy, right? What are the risks and benefits involved in our services? Is one of the things that we wanted to highlight. I don't know if there's anything you'd like to add to that or.
I think that you put that so beautifully, and just the idea that we're not thinking just about our own safety, but also taking care of those folks that we're engaging with. and how that really is relevant to sex, and also more than ever right now to any physical contact whatsoever, right? And so when we think about how to be ethical and kind and caring with our sexual partners, it includes having the conversation about what precautions will be taken, what each party is comfortable with, not necessarily a history of every sexual partner, but certainly a conversation about what are the boundaries of the relationship. Is it monogamous or not? Conversations about sexually transmitted infections. So that's what it looks like to have a sexual relationship that involves consent. And I don't think we're necessarily thinking about how does consent apply right now, right,
Right.
when we're all facing this crisis, and it's more important than ever. And I know that for me it would be really important, if I was considering breaking quarantine, so to speak, to spend time with somebody, to know, have you been to the grocery store in the past 2 weeks? Have you seen, your grandparent or whoever it is? And so that it's not just one person saying, I think I've taken enough precautions, we're good.
Mhm.
And that means that I don't need to disclose. I don't need to have these conversations.
And a big one, especially here in Boston area, is do you have roommates, right? Because we also can't necessarily ensure that we know where someone's roommates have been. And if those roommates are not taking the same precaution as your friend, then that is also elevating your risk. And so there's a lot of lines of precaution that, as you can probably tell without us having to continue to belabor the point, is similar to safer sex practices. Um, the other,
Absolutely. Oh, I'm so sorry. I was just going to say that there's this chain of connection, right, between yourself and the other person and themselves and who they've had contact with, and thinking not just about that moment in time, but about that whole chain is
right.
what essentially we're urging you to do.
Yes. And, along those lines, obviously, if you've been sick or you've had a fever or you're, concerned that you're feeling sick, we are strongly recommending, in line with the current CDC guidelines, and you'll see our links to our resources below. So obviously, we're not just pulling this out of the air, to stay home.
Mhm.
Um, if you need groceries, see if maybe you can arrange another option. But just try to make sure that if you are feeling sick and you have that elevated concern, to take the appropriate precautions that have been outlined for us at this time. And just making sure that it's best to refrain from being in contact with other people in any capacity. And if you have sort of emergency contacts, making sure that other people are aware that you're not feeling well so that they can be checking in virtually with you to see how you're doing. So if you do live alone, you're not totally isolated if you aren't feeling well, in terms of someone knows that I'm not feeling well.
I think those are great pieces of advice.
Yeah. Um, and then just along those lines, I'm also thinking I'm an allergy sufferer. So, and this is the height of allergy season, April. And so I've been having a lot of sneezing, itchy eyes, and so on. Just making sure for allergy sufferers, we're probably feeling a heightened level of paranoia right now, and just making sure that you have the appropriate information about what the distinction are between the symptoms and what to look out for. I mean, obviously, if we've lived with allergies our whole lives, we probably have a intimate sense of what our allergies are like. But certainly that doesn't mean that we shouldn't also be cautious.
I think that's such a great point. And the fact is that, respiratory symptoms can show up with so many different causes, right? The common cold, the flu, COVID-19, allergies, all of these show up in ways that overlap. And so I think I would urge folks who have any symptoms that don't feel familiar to you to be in touch with your medical provider as soon as possible. And oftentimes people wait because they maybe want to see how things develop, or they're, in where we're at now at this point in times. I know some people are nervous about going into medical settings, but you can always call, or, a lot of practices and hospitals, they have the patient portal where you literally just shoot a text or an email to your provider. So I would urge folks to, as part of being cautious, to reach out sooner rather than later.
Right. Yeah.
Yeah.
And, you know, we just want you to remember, as we said earlier, that you are your safest sex partner.
And your safest COVID partner.
Oh, we're such geeks.
Yeah.
Our therapeutic geekness is showing. But, you know, if you want more sort of concrete medical related info and other things, we'll have links that we provide in the description of this video. But unless you had anything else that you think we should add, I think that just about covers it for today.
I think so too. I hope you all have enjoyed this video. If you'd like additional videos that have to do with self-care or, you know, nurturing relationships, hobbies, etc., while in isolation, we'd be happy to do something like that. And because Sarah, I've really appreciated this time for us to collaborate together.
Yes, likewise. And we'll both have links to our websites where we are collating additional resources. And also, for me especially, I'm trying very hard to share resources that are being made by clinicians who are people of color right now. And so you'll also see a link to Luana's page on my website too.
And
So,
my website has a link to the wonderful blog he wrote a week or two ago.
Thank you. Thank you.
So between the two of us, there's a bunch of links related to self-care, related to mental health, related to free stuff going on online. And yeah, we'll include those in the show notes, so to speak.
Yes. So stay healthy.
All right.
Stay safe, and remember that you define what strength is. We'll hopefully see you in another video.
Thank you, everyone.
Right,
Bye-bye.
bye.